about 8 hours to take calls. So I'll be giving a statistical report on that. Let me just start by welcoming the esteemed guests, staff of State Mental Health Institute, my Tele-Manas team, and of mental health care, exploring an initiative that is transforming lives and bridging gaps like never before. With great enthusiasm, we will comprehensive report on the performance of Tele-Manas, a project that is not only making a difference, but it's also reshaping the landscape of mental health services across India. Now, let's begin by taking a look at the progress of this project as a country. In a place as diverse as India, where the complexities of modern life often take a toll on our mental well-being, the need for accessible and compassionate healthcare has never been greater. This is precisely where Tele-Manas steps in, a project that transcends geographical boundaries and is making strides towards providing timely support to those in need. As the Tele-Manas project crosses a significant milestone with over 200,000 calls received on our toll-free number, launched in October 2022, it identifies the commitment of our government to provide accessible mental health care for all across the country. With over 40 hotels across 31 states and union territories, the services is currently to about 1,300 plus calls per day in 20 languages with over 900 trained counselors, running first-line services, and now Nagaland can proudly say that we are part of the team. Our service has become a beacon of hope for individuals facing mental health challenges through the utilization of technology. It breaks down the barriers and connects people with mental health professionals regardless of their location. Tele-Manas' remarkable impact resonates in every corner of our nation as individuals from various walks of life seek solace, guidance, and support. Now let's zoom in on Nagaland and conduct a comprehensive analysis of Tele-Manas services. From the month of June till date, the numbers paint a vivid picture of the project's impact. A total of 50 calls have been received, signifying a dynamic engagement with those in need, where an overwhelming 48 calls were initiated by users, underlining the project's success in fostering awareness and trust. The remaining 8 calls were callbacks initiated by our dedicated team, exemplifying our proactive approach in reaching out to individuals who may require assistance but may not have the ability to ask for it. Now, in moments of crisis, Tele-Manas' significant shine. This demonstrates our role as a lifeline during critical times. The project's consistent support is reflected in the 60.71% of routine calls, which demonstrate the demand of ongoing mental health care assistance. Although 3.57% prank calls were made, they are a minor concern, and efforts have been taken by the center to minimize them and ensure the seriousness of the service remains intact. 66.67% callers constitute female callers. It reflects significant participation from women. It shows how women are more prone to be emotionally driven. And male callers were 33.33%, indicating a potential area where we can do outreach programs to the male demographic. So that we can ensure that there is equality among care. So 9 out of 10 calls were from Dimapur, 6 out of 10 calls were from Kohima, and 1 out of 10 calls were from Aizawl, Mon, Twensang, and Zungato. It's noteworthy that places like Mon and Twensang, which are known to be difficult to reach, are included. So you can see here how Sir has emphasized it's going to reach hard places where there is no healthcare facility or where it's difficult for healthcare professionals to go to. Tele-Manas is a ray of hope for those in remote areas, addressing the gap in mental health services. Also, you might be wondering why Aizawl is here. Since Sir has already mentioned that we are networking across states, this does not only include Nagaland and the districts. We are getting involved with every Tele-Manas cell in India. This is a chance for Nagaland to be connected to the mainland instead of looking at it through a filter. We have recently received a call from Jharkhand as well, a caregiver seeking help for a family relative. So it shows us the capacity and the capabilities that we can have with this facility only if we focus and pay attention to where help is needed.
Like Swim explained, when a call comes in a Tele-Manas cell, it is an interactive voice response system which takes the call, and then it asks us whether we want it in English or Hindi, and then as we press English, it asks us which state. As we press Nagaland, the calls are directed here. So these systems will be on 24/7. We had some breaches which we'll be discussing with Sir at a later time. So once this call comes, we have trained counselors, like the one who received, and depending on the level of care which the person requires and the, let's say, the capability of the counselor, he or she takes the call and then tries to dispose of the call. If he or she feels that some more counseling is required, he or she refers it to the psychologist present or the clinical psychologist who is present, or we have a psychiatric social worker present. The cases can be referred there. If still the team feels that some complex evaluations are required, managements are required, then they refer the case to, a senior consultant who is yet to be appointed. But thank you so much, Dr. Nohutso, who is always here supporting the team always, and making us encouraging us always that he's always there to handle any case if we can't handle. He's always there. Thank you, Nohutso. So in the course of the call, if the team again feels that yes, this person needs in-person services, then the team links the person to the DMHPs, the district mental health programs, where psychiatrists are there. For example, the person calling from Tuensang needs an in-person service. It will be linked either to the psychiatrist or the team of DMHPs present there. Suppose the person calls from a very interior place, maybe a rural area where we have a community health center or primary health center. The team will link the person to the doctor there. Or if the doctor is not there, to the nurse. Or if nurse is not, even to the Ayush doctor. And thereafter, the protocol of referral will start again if it cannot be reached. The Ministry of Health and Family Welfare, Government of India, proposed for a mental health program in 2022 called this Tele-Manas. The Tele-Manas is a tele-mental health networking system where they have formed this national advisory boards for Tele-Manas and also committees. Thereafter, we were asked to look into the implementation with specific goals and objectives for Tele-Manas. One of the main objectives which I've learned in the past few months is Tele-Manas ensures the universal access to equitable, like Nohutso said, affordable and accessible tele-mental health services. Now these services, as mentioned, is 24/7. And basically, this is a digital component of the national mental health program. Now, Tele-Manas is a very comprehensive program where we consider it as a digital arm of the district mental health programs. Now, when we look at the organizational structure, we have so many steering committees at the central level. However, from day one, we have been conducting NIMHANS, that is the Apex Nodal Agency for mentoring and monitoring the Tele-Manas program. We also have the regional institute, that is LGB Institute Tezpur, and we also have for technical support the IIT Bangalore. Now, our technical coordinator and the team has been contacting with all these people since day one. Dr. Kezo was here. He did a lot of groundwork, and I really acknowledge him for that. and we have reached this far with the contribution teamwork. To make it possible, the center has decided to Tele-Manas cells such as this. Today we are here because of the kind support, guidance, and initiation of our MS, Dr. Chrissy. Thank you so much, sir, for this wonderful.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapu viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.